This is my Session 3 presentation, Surviving the Winds of Change by Abigail Hathaway. Changes and reasons. So due to new federal regulations imposed upon healthcare facilities, there is now a requirement for an update to our facilities technology. The new norm for our facility will include the use of electronic tablets for patients, rolling kiosks for nurses, and laptops for physicians. The purposes for implementation will include quicker patient check-in, more efficient use of forms and assessments, readily available patient records, a decrease in data entry mistakes, and an increase in communications across platforms. So the implementation of change. Implementation of the new electronic tablets, rolling kiosks, and laptops will be issued through a developed plan over time in different phases. Phase 1 will include the employee training of electronic tablets and systems. Phase 2 is the electronic tablets implemented for patient use. Phase 3 will be employee training of rolling kiosks. Phase 4, rolling kiosks will be implemented for nurse use. Phase 5 will be employee training of laptops. Phase 6, laptop implementation for physician use. And Phase 7 will be the measure of changes before and after commencement of the new technologies. Phase 8 will be the feedback phase, where we will collect and address any new technological issues that may arise. Internal policy changes and external support will be pertinent for the success of this technological rollout. So, impact in the workplace. Patient information will be easier and quicker to access for employees, which will overall increase the efficiency of the workplace. Communication will increase amongst healthcare personnel due to accessible information along with data entry error being minimized. Time will also be saved due to one-time data entry instead of multiple paper records followed by additional system input. Impact on patients. Patients can be in control of entering their information into the tablet and feel like they have a greater sense of control at the facility. The use of check-in tablets will reduce the amount of time patients need to wait in order to be seen by the physician. Patients see technology use as an efficient way for healthcare facilities to show their advancement within the field. Measuring employee impact. Archibugi and Pianta explain the demanding tasks involved with measuring technological change over time and that innovation is not a linear process. Levy states that problem-solving teams are utilized by organizations in order to encourage lasting improvements. Therefore, our healthcare facility will organize a team of individuals to assess and measure phase implementation and usage results through feedback mechanisms such as interviews and overall periodic assessments of the facility's new operational efficiency. Measuring patient impact. In order to measure patient impact over time, there will be a review of patient experience through use of exit surveys assessed by the problem-solving team on a periodic basis. Innovation surveys can identify new sources to be used by organizations in order to sustain innovation over time. According to MTI, through survey, 79% of patients felt more connected to healthcare providers when they used technology instead of spending a majority of their time on paperwork. So the feedback process for the new system. According to Levy, evaluation is a highly overlooked step when it comes to the implementation of new systems in the workplace. Therefore, proper planning for, utilization of, and periodic assessment should be a priority for ultimate success. Exit surveys will be provided to patients for their input on the use of new technologies. Employees will be asked to provide improvement suggestions based on what they observe needs to be changed after implementation of the new technologies occur. So an overview. Through use of electronic tablets, rolling kiosks, and laptops within our healthcare facility, there will be an enhanced patient experience with less error in record keeping and inter-office communications, ultimately creating a more efficient experience for both patients and providers. Overall, technology implemented properly within the healthcare facility will allow us to serve the community on a greater level and let us not grow weary of doing good, for in due season we will reap if we do not give up. And that is the end of my presentation. Thank you.